Hi, my name is Dan Poenaru. I'm a pediatric surgeon and a professor of pediatric surgery at McGill and at Children's Hospital. I'm also a researcher, and in fact, I'm mostly a researcher at this point in time. And I want to tell you a little bit more about our lab because I'm very excited about what we do in our lab. So our lab is called CommiSur Lab. Obviously, it's a little play on words on communication in surgery. But actually, the I in it means innovation, because increasingly we move towards innovation within surgery and within communication and surgery. So our lab has three large axes, almost equal in size, and students are distributed among these three axes, and projects are distributed this way. Our first axis is patient communication and patient-centered research. So this is research about patient-reported outcomes in general, especially because we're doing primarily children. We're trying to hear the children's and the family's voice in this research. We do stuff on the consenting process in surgery, on trust in surgery, and we have some large CIHR funded projects that follow children that have had neonatal surgeries over their entire childhood up to the age of 18, establishing health trajectories for each congenital disease, and within these trajectories trying to identify inflections and transitions in the childhood where different types of resources need to be offered to the children as we follow them up. So that's the patient-centered area. Our second one historically has been global surgery, and that includes all issues of equity in surgical provision, primarily globally, but also in Canada. So we have several fellows who are international fellows from low and middle income countries, and they do research that is meaningful to them and to their context. So we have two CIHR funded projects on gender equity in provision of surgical care for children. One is in Asia, the other one is in Africa. We also have projects here on intersectionality in surgical care, which is quite sort of new, and some more standard global surgical projects, such as improving neonatal outcomes through screening and provision of interventions at the community level, and this happens in Africa as well as in Asia. So that's our second axis. And the third axis, which is the one that I'm probably right now most excited about, is healthcare AI. We've pretty well profiled ourselves as a leader in healthcare AI, particularly in clinical AI. We started off with projects in machine learning for predicting appendicitis outcomes and classifying, for example, perforated appendicitis using machine learning. That was CIHR funded, and we're continuing in that direction. But most of our projects currently are in large language models and generative AI, and we're using it in multiple ways to automate research processes. So we now do most of our systematic reviews using AI screening. We started creating synthetic studies where we generate personas of patients and then use these personas for various so-called in silico studies, which is very, very interesting. We also have some more standard uses for large language models to summarize medical information in order to improve the interaction, again, between the communication between patients and their providers, when the providers don't spend all their time reading through notes, but rather spend their time in the with the patient because they've received the summary, which has extracted information that they need to have. So those are the main areas in our lab. We're quite an active place. We have over 20 graduate students in our lab, and one postdoc. And I co-supervise as well quite a few students, both in medicine and healthcare, as well as in computer science. And that gives us a lot of resources that we need for various projects. And the lab is sort of unique in that we have a real esprit de corps. We have a real we're very much together. We have retreats in our homes where we just have fun and potlucks and spend time together. The lab, the architecture is very flat. Although for supervision, there's often levels of supervision, so that a master's student will be supervised maybe by a PhD student and then myself. But it's very much a safe place of exploration. Any good idea is explored. We like to take sort of risky paths of the sentier battu. But that's who we are, and I love it.
Are you currently recruiting any students? If so, what are you looking for?
So recruitment is difficult because we've over-recruited over the past several years. So we're a little bit static on that. Really, recruitment depends on our grants, and we have a constant flow of primarily CHR grants that allow us to recruit students. But in general, if people are interested to volunteer in the lab, I prefer not to give them some sort of an orphan project, but rather I'm more interested if they come with a desire to do something. And if that project that they're interested in fits into the general ethos of our lab, then I'm interested in working with them, yes.